I got a $50 gift card for entering this competition. With $50, I would rather buy 5 meals from McDonald's than to buy kale at Whole Foods. I know that many other students would too. 1 in 3 adults today are pre-diabetic, and diabetes is the most expensive chronic disease in the US. Treating diabetes isn't easy, especially for those with financial insecurity or coexisting diseases. Think for a moment. Who do you see and don't see shopping at Whole Foods? The socioeconomic gaps are here. Defining these gaps in healthcare might help reduce inequalities in care, but how? What if we could identify and target patients in San Francisco that need better care by using social determinants of health? These are the conditions in which people are born, work, and live that affect their health outcomes. With social determinants data, we can better understand a patient's overall health. But right now, social determinants are not widely used in health records to understand differences in healthcare, especially in diabetes. That's unacceptable. My goal is to change this. Here at UCSF, I'm leveraging an unprecedented data set of nearly 9 million patients. As a pioneer, I'm using patients' home location to better understand their housing, employment, education, and poverty status. To determine associations between social determinants and diabetes, I sifted through health records to select diabetes patients based on their treatment history. I stratified patients living in rich and poor neighborhoods with the goal to understand differences in outcomes and treatment patterns based solely on their location. I then built artificial intelligence models and found that patients from poor neighborhoods were prescribed cheaper, possibly less effective treatments. They also presented for care much later than patients from rich neighborhoods. But why such a disparity? And how do we fix it? I'm exploring these questions further by diving deeper into diabetes treatments, outcomes, and other conditions that affect patients' health. My work shows that we cannot ignore social determinants of health if we want equitable healthcare. I envision a day where we will use all this data to help improve health outcomes nationally, reducing more disparities in health than Whole Foods could ever imagine. Thank you.